Hello and welcome. Today we're shedding light on a serious condition, squamous cell carcinoma of the ear. This video will explore its causes, symptoms, diagnosis, treatment, and more. Understanding this disease is the first step in combating it, so let's begin. So, what causes squamous cell carcinoma of the ear? The primary culprit is chronic exposure to ultraviolet, or UV radiation, most often from the sun. People who spend a lot of time outdoors without proper ear protection are at a higher risk. Other potential causes include chronic inflammation or irritation of the ear, for example, from chronic ear infections. Certain genetic predispositions and weakened immune systems can also increase susceptibility. Human papillomavirus or HPV has also been linked to some cases. Let's delve into the pathophysiology. Squamous cell carcinoma begins when normal skin cells, called keratinocytes, undergo abnormal changes in their DNA. These mutated cells then begin to multiply uncontrollably. Over time, this uncontrolled growth forms a tumor. In the ear, this often starts on the outer ear, or pinna, but can spread to the ear canal and even deeper into the temporal bone. The tumor can invade surrounding tissues, including cartilage, bone, and even nerves, leading to significant complications. Now, let's talk about epidemiology. Squamous cell carcinoma of the ear is relatively rare compared to skin cancers in other areas of the body. However, it is the second most common type of skin cancer found on the ear. It typically affects older adults, usually those over 60, and is more common in men than women. Individuals with fair skin who live in sunny climates are at a greater risk. Statistics vary depending on the geographical location and population studies. What are the signs and symptoms to watch out for? The most common sign is a persistent sore, bump, or scaly patch on the ear that doesn't heal. This lesion may bleed, crust over, or change in size or shape over time. Other symptoms include pain or tenderness in the ear, a persistent discharge, hearing loss, or even facial weakness if the cancer has spread to nearby nerves. Any unusual changes in the appearance or sensation of the ear should be promptly evaluated by a medical professional. How is squamous cell carcinoma of the ear diagnosed? The diagnostic process typically begins with a thorough physical examination of the ear and surrounding areas. The doctor will inquire about your medical history and any symptoms you've been experiencing. A biopsy is crucial for confirming the diagnosis. During a biopsy, a small tissue sample is taken from the suspicious lesion and examined under a microscope by a pathologist. Imaging tests, such as CT scans or MRI scans, may be used to determine the extent of the tumor and whether it has spread to nearby lymph nodes or other structures. Squamous cell carcinomas of the ear aren't typically classified into different types, in the same way that some other cancers are. Instead, they are generally categorized by their stage, which indicates the size and extent of the tumor, and whether it has spread to nearby lymph nodes or distant sites. Staging helps doctors determine the most appropriate treatment plan. Treatment options for squamous cell carcinoma of the ear depend on several factors, including the size, location, and stage of the tumor, as well as the patient's overall health. Surgery is often the primary treatment, involving the removal of the cancerous tissue and a margin of healthy tissue around it. In some cases, reconstructive surgery may be necessary to repair the ear's appearance. Radiation therapy may be used after surgery to kill any remaining cancer cells or as a primary treatment option for patients who are not candidates for surgery. Chemotherapy may be considered in advanced cases where the cancer has spread to other parts of the body. Topical medications may be effective for very superficial lesions. Prevention is key when it comes to squamous cell carcinoma of the ear. The most important preventative measure is to protect your ears from excessive sun exposure. Wear a wide-brimmed hat that covers your ears, and apply sunscreen with an SPF 30 or higher to your ears when outdoors, even on cloudy days. Regularly examine your ears for any unusual changes, and promptly report any suspicious lesions to your doctor. Avoid tanning beds, as they emit harmful UV radiation. If you have a history of chronic ear infections or other skin conditions, work with your doctor to manage them effectively. The prognosis for squamous cell carcinoma of the ear is generally good, especially when the cancer is detected and treated early. The 5-year survival rate for early-stage tumors is high. However, the prognosis can be less favorable for advanced tumors that have spread to nearby lymph nodes or other parts of the body. Recent research is focused on developing more targeted therapies and improving reconstructive techniques to enhance both survival rates and quality of life for patients. Scientists are also exploring the role of immunotherapy in treating advanced cases of squamous cell carcinoma. Thanks for watching, and remember, early detection and prevention are vital in combating squamous cell carcinoma of the ear.